Iza kucheza za ziankulo zanji zanchito, ndiza dimayankula chichewa muchipatala kumalawi. Ndima wauza chuchuchu. So, the first part of that was a standard Chichewa greeting. Moni anzatu, maswera bwanji, unyumba aliwanji. And I think the second part was, I stumbled over it, but I said, we're going to talk about talking and talk about using language in the hospital where I work. And then I ended by saying something that I'd like to say just because it's got such a fun sound to it, which is a promise to tell you the truth, which is ndiwauza chu-chu-chu, which you have to say with emphasis like that. So right off you can hear interesting things about this language. The rhythm of it sounds different. Some of the ways that the sounds are put together are different. So for most of us English speakers, for instance, we can make this sound moi inside a word like homework, right? No problem to have moi there. But to have moi at the beginning of a word, moisuera, that's a little weird, right? That doesn't feel natural in our mouths. The rhythm is different in other ways, too. You might not have noticed, but when I asked you questions, my voice didn't rise at the end. I said, moisuera bwanji, right? So that's, how are you, right? So my voice didn't go up like a question. And in fact, that last I almost seemed sort of half swallowed. It's a sort of a sing-songy language. I think we learn even a little bit more as we delve into the meanings of the words. And I'll just go through this greeting part here. So the first part is greetings, our friends. So even if I was just talking to Lauren, I wouldn't say greetings, my friend. I would make myself plural and I would make her plural because we're both adults. And when you're an adult, it's respectful to speak to each other and to speak of yourself in the plural form. If I spoke in the singular, if I said, hello, my friend, even though it sounds very friendly, it would be kind of rude and bossy, actually. I would be talking to her as if she was a little child and disrespecting myself in the process. Then I said, how have you passed this day? So that's a greeting that's only appropriate for the afternoon or early evening. If it was the morning, I would say something like, how has the dawn reached you? If it was really early morning, I would say, how have you slept? So the time of day is important here. The last line is, at your home, how is everyone? It's also impolite to ask after Michael's health without asking after the health of his family. So I always follow the standard greeting with asking about the well-being of a person's family. So this already gives us some little insights, I think, into a culture that's a bit different from kind of my mainstream Midwestern Euro-American culture growing up. If we delved a little bit further into this language, we would find out all sorts of fascinating things. Now, this is not actually what I've been asked to talk to you about today, so I'm going to really restrict myself, but I just want to point out a couple of them. One is the pronouns. So I can say, in English, I can talk about this or that. But in Chichewa, I can't simply say this or that. I have to say this right here, this near here, this over there, this out of my sight, or similarly, that right here, that near here, that over there, that out of sight. So location, precise location is so important that it's actually mandated in the structure of the language. Probably many people in the room have studied European languages, as I have, in which nouns are classed by gender. So all nouns are male or female, or sometimes male or female and neutral. Chichewa has noun classes too, like a lot of the like most of the African languages do, but there are 9 of them and they have nothing to do with gender. Instead, the first class is people and certain important animals. So, for instance, animals like the chameleon and the rabbit that are really important in folklore go into that first noun class right along with people. Then there's abstract concepts like journeys or borders. There's a different noun class that takes whole different sets of prefixes, not only for the noun, but also for all the adjectives you stack onto it and the verbs that get used. Objects that have something on them, objects that one is approaching are one noun class. Now you can think, well, wait a minute, what if one's not approaching it? Is that object still the same noun class? Alas, no. If that object is just sitting there and you're not walking towards it, it's a different noun class. So this is a really, really different way of putting together the world, and that's interesting. The 6th noun class is mostly things made by humans, and when there are imported words from English, they often go in there. And to be completely honest, I've never figured out a unifying theme to classes 7 through 9. I'm starting to get a feel for them so I can guess when I learn a new word where it's going to go, so there must be some theme there that it's just not available to my conscious mind, but I don't get it yet. In addition, this language isn't stable. It changes fast. It borrows lots of words from neighboring languages. It borrows lots of words from English. I've been going back and forth to Malawi now for 22 years, and I've actually been able to notice some changes. So I'll give you 2 quick examples. These little fried dough balls on the left are usually called, or were called when I was first in Malawi, mandazi. They're great street food, really tasty. I'm sure they're just as healthy as our pizza is tonight, too. So since we're speaking of global health. So I love to eat them. For a while, in the early 2000s, in fact, not too long after 9/11, they were called Bin Laden instead. And yes, that's after Osama. And nobody could explain to me why. They stayed Bin Laden for a few years. It was during a period of time when the Muslim minority in Malawi was, instead of being sort of marginalized, was briefly quite prominent because the elected president was a Muslim. So maybe that had something to do with it. It's just a guess. The last few times I've been back to Malawi in 2007 and again in 2010 to 11, they're back to Mandazi. They're not Bin Laden anymore. So a more routine example, these things that the guys are carrying on their bikes on the big stalks, they are what you and I would probably call bananas. In Chichewa, that word is ntochi. But now in the urban settings, they're starting to be called more often mabanana, which is a sort of a Chichewa-ized version. It's the right prefix that you put on to make a plural, but obviously the root is banana. So in the rural areas, they're still ntochi. And urban people understand the word ntochi, but when they speak, perhaps as part of being, hip and current, they're mabanana. Many of these loanwords are coming in to the extent that urban and rural Chichewa are more and more different. You could almost even think about them as a couple of dialects, different dialects at this point. So I could go on and on about this. It might not surprise you. My undergraduate major was linguistics, and I think language is really fascinating. But what I was asked to talk to you about was using language in global health. So I'm an obstetrician. That's my first training. I'm also now a medical anthropologist. But when I go to Malawi, I work in a large hospital there, Queen Elizabeth Central Hospital, and I see patients there. And although all nurses and doctors speak English because all secondary education and beyond is in the English language, most of my patients still do not. So that's been the major place that I've learned Chichewa. I first learned it, a few words, probably 200 words, when I was there in 1990 as a medical student myself, a long time ago, for a few months on the wards. When I came back, I didn't go back for 11 years. And when I came back to start conducting some research in 2001, 2, and 3, I knew that I would need more Chichewa. So I prepared by using an old taped course that was put out by the Foreign Service in the 1960s for diplomats. That turns out to be pretty outdated, and a lot of the language that I learned was extremely old-fashioned, but it was still a good way to start learning the language. I'll tell you one sort of story about first learning this language. So I had really studied hard with this Foreign Service course, and I was ready, and I was going back to Malawi to start a year-long stint there at the hospital in research. And my partner and I got off the bus at the bus station and started walking to where we would be staying. And my partner doesn't speak Chichewa, or didn't at that time speak any Chichewa, and was asking me, well, what does this sign say? What does that sign say? And I was feeling really confident because I was translating it until we hit this extremely blurry sign up in the corner that you can't see. But I was just so thrilled that I could find a version of it online at all. I brought it anyway. So what it shows is a young man and a young woman, and they're sort of flirting in a marketplace. You can tell they're flirting because she's looking down like this and sort of looking shyly at him and has her hands together politely. And in the corner is a picture of this shield here. Chishango means shield, so I knew what that meant. And my partner said, well, what is that sign about? What is the slogan on the top? And I read it and I said, clearly, I don't understand Chichewa at all. Because what this sign, what this translates as to me is, when one goes to the lake, one may also see hippos. And I was actually very discouraged. Now, I found out later that that was a correct translation. Can anyone guess what this sign is about? Condoms, yes. Chishango the shield is a condom. What do hippos in the lake have to do with that?
They congregate.
They congregate in the lake, and they're dangerous. So the point of when one goes to the lake, one may also see hippos is when one goes and does something fun, there can be dangers lurking underneath the surface. So as a matter of fact, just like we say, well, that's just the tip of the iceberg, to talk about something really, large and scary that nobody's talking about that's under the surface, Malawians say, well, that's just the ears of the hippo, because that's what you see, right? In neighboring Mozambique, oddly, it's the nose of the hippo. So I don't know if their hippos are different or if the proverb is different, but it's sort of interesting. Before going back for more research, I then spent an intensive summer studying with a native language speaker, and I have to say that was a far better way to go than the Foreign Service tapes. So I do have some capacity in other languages. I have a reading knowledge of French and German, which has been very useful, not just for reading old materials in the archives of African studies, which is important, but also because some contemporary material is not translated. So for instance, the best book that I know on practical matters of integrating traditional medicine and Western biomedicine is only available in French. It was written by a Rwandan physician, Pierre Rwangabo. And so if you can't read French, you don't have access to that at this point. I have to admit that I'm not a very good person to be on this panel in some ways because I am far from fluent in Chichewa. My Chichewa is really intermediate. And in fact, every time I come back to the US, it sort of goes downhill. And then when I go back to Malawi, it beefs up again. But even with only an intermediate level of proficiency, learning it and using it every day in the hospital where I work has helped me in several ways. The most practical is probably the really obvious one. Where patients don't speak English and where there are very, very few doctors and nurses available, where there are very few educated translators, I have to be able to communicate in some ways. So it's not ideal. It's not something that would be, my Chichewa is not really good enough to understand the subtleties of somebody's stories, but I can get the main points. I can't always pick up all the euphemisms. I have to have them repeat, and I have to have them talk slowly. But I can get the main points, and I can make myself understood too, and that's essential in a place where there just are very few people who are able to sort of mediate that. There are some other points about learning and using the language that might seem a little subtler. It's respectful to try speaking in the language in which you're immersed rather than insisting on using your own. It also changes the power dynamic. I'm American, I'm white, I'm a doctor, and I'm wealthy by comparison to almost every Malawian that I meet. So there is a huge power gulf in between us, and it's I'm the powerful one. But in their language, they are the experts, and I'm the beginner, and they're teaching me. And that actually has sometimes, I think, made a big difference in managing a clinical encounter at all. And finally, just sort of back to the initial notes, it's really fun. It's really interesting to learn a language and think about how other people put their worlds together and how they're similar to mine and how they're really different to mine. And that's a fun thing as a doctor and as an anthropologist and also just as a human living in the world with other humans. So that's my takeaway here.
My area of expertise is in maternal newborn health. I'm not an obstetrician, but I've been working in international public health, international maternal newborn health, particularly in the area of maternal and newborn mortality reduction. I have recently come on campus. I'm working as an honorary associate. They've been kind enough to give me an honorary associate appointment in the Department of Population Health Sciences, and I have an honorary fellowship with the Center for South Asia. But in between that, I do consulting for USAID and for the World Bank on assessing and evaluating programs, large programs in maternal newborn health. But today it's great to come to talk about how language is used in my practice of global health. I've been impressed in my short time on campus how the university is really trying to pull together different departments. particularly through the Global Health Institute. I think that the mandate and the mission statement of the Institute is to have a cross-campus interdisciplinary approach to some of these big problems that we're facing globally, both from public health issues, global health issues, from environmental sustainability, issues in politics. And we really need to kind of look across disciplines and find solutions together. And I think the university seems to be doing that. I mean, the traction really hasn't started yet, but working with the Department of Engineering and Ag Sciences and now Global Health, and now I think what I'm seeing is that the addition of specialized studies in language as well is being kind of brought together. So it's a very exciting initiative on campus, and I'm excited to be a part of it. My experience with language has actually been twofold. Beginning initially with French, I was a student in Paris. My family moved to France when I was still in high school, and so I was fortunate to be completely immersed in the French language in the 1970s, late 1970s. And that period coincided with the invasion of Afghanistan by the Soviets in 1979. And I was just finishing my studies. I had just passed my baccalaureate in French and was kind of part of the French student community. And there was a big outpouring of kind of international solidarity, but the French community themselves became very interested in and were very vocal about speaking out about the abuses against civilian populations who were being deeply troubled by the issues going on with landmines and the refugee situation. So I was part of a kind of a cultural movement within France that was really important for my overall development of my global view. I then got very involved as a teenager, still kind of 18 and 19. I was working for a French non-governmental organization, Aide Médicale Internationale, packaging medicines very early on, starting to write documents in English, translating documents from French into English for press releases, and also translating first-hand accounts from physicians and doctors who had gone into Afghanistan in the 79 and 80, 81. And these were the first reports coming out of what was really going on in Afghanistan. That early connection then led on to a long 15-year engagement with the French humanitarian community, including Médecins Sans Frontières. I worked very closely with Bernard Kouchner, who was the founder of MSF, the Doctors Without Borders. I worked as his translator and assistant for a number of years. He then went on to become Minister of Humanitarian Affairs for the French government under a socialist government, then became Minister of Health, and then most recently, up until 2010, was Minister of Foreign Affairs in France. But this early kind of acculturation, it's kind of having a different perspective, both from the language point of view, but also in terms of what is the worldview. And the French had a very particular worldview at that point, which was about droit de témoignage, where you have the need and the right to bear witness about human rights abuses going on. That was a very basic principle that is not American. It's not American. Le droit de l'ingérence, the right to intervene, which means that international citizens have the duty and the right to intervene to cross borders, which is really the foundational idea for MSF, that we have a right as human citizens of the world to intervene where we see human rights abuses. So that whole early experience was very fundamental, both learning the language, but also the culture, the political culture, the human rights culture that came with that experience. That led to being able to work for a number of international organizations, including the UN, the World Bank, and UNFPA, for French bosses working in a French environment, French working environment. So both, reading, writing, speaking, and being in a very French-oriented, which is not an easy thing. That whole experience was foundational for me in terms of my work in global health, my ethics, the way my kind of global view on health developed. Parallel to that, but although it has intersected again and again over time, has been study of South Asian language. My early interest through the French organizations, going into Afghanistan, working with that community, I became very interested in studying South Asian languages. And I began at Columbia University studying Hindi because it was really available, and it was one of the first-class institution teaching Hindi, which was an unusual experience. I wanted to learn. But I then wanted to return to South Asia, and I applied I wanted to spend a full year abroad really studying the language more in depth, and I applied for the UW-Benares program through Madison. I didn't get in because I only had 1 year of Hindi. But I was sent to Pakistan on a Berkeley Urdu intensive a language program in Lahore for a year in 1985. So that then became kind of a trajectory that I followed for a number of years, which again intersected with my work with the French community. I went on to become a FLAS Fellow, a Foreign Language Area Studies for South Asia Fellow at Columbia in graduate school. So I continued to study Urdu intensively, studied Farsi, which gave me some ability to work with the Afghan population through Dari. And then I ended up spending 15 years in Pakistan working for a number of different organizations. It can't be overemphasized the importance of being able to speak with the community you're working with. Not only the ability to speak, but through the study of language and culture, poetry, music, all the things that will come with your study of language, you start to really see the culture and to appreciate it, to understand the depth of it. That has helped me immeasurably in my work in global health. Specifically, doing primary research in the field. I wasn't dependent upon translators or intermediaries to kind of filter the information for me. I was able to conduct my own surveys, talk to women directly about the issues that were affecting them. Certainly not with great fluency to start with, but over the course of a number of years, I improved greatly, and as a result, the work's deepened and enriched. I think the other aspect is being able to work with a community of non-governmental organizations within the country itself. Once you become a little bit more familiar with the language and the culture, then you start to create partnerships with people in the country, and not always working separately through the UN agencies or through different agencies, but going, more homegrown and starting to work locally, finding partnerships within the field. And I think it also helps working with government officials, working with ministries of health, with district health management teams. So it gives a kind of a breadth, which I think has made my work more effective and more enriching for me. And it's damn fun, too. Just one small plug for international studies and families. I essentially raised 3 sons in Pakistan, one of whom is here right now, all of whom themselves learned both Urdu, Punjabi, Saraiki, and were immersed in that culture, I think that you can have a life and overseas doing international work and for it to be enriching both to family life, to personal, and to the work. So, thank you.
Well, I'm Molly Overby, and as you can tell, I might look a little young to be on this panel and talking to you about using language in global health. But I guess I wanted a perspective of someone who's maybe at a step that's closer to where students are, sort of thing, because I just graduated last August from UW-Madison. I didn't specifically study a language, but I did get, my major was in LACIS, Latin American Caribbean Iberian Studies. And I took Spanish courses as a part of that. I studied abroad in the Dominican Republic as a part of that, as well as in Ecuador. And yeah, so right now, I guess how I got to where I am, which is just a few steps away from where I guess a lot of students are, is that I started working at the Global Health Institute when I was a sophomore. And one of the big things that got me in was how I was even just interested and kept up to date and was in classes, and it was just my area of study sort of thing was global topics, and I was also studying Spanish. So even something as small as knowing a language like Spanish can help you get your foot in the door, because I was just hired because I could be used to like translate emails and communicate with community partners because a few other people in the office couldn't speak Spanish, so I could just be used as a translator, which is a very simple like first step thing you can do, and then you can work your way to other amazing things like working with NGOs and being a doctor and all that kind of stuff. But I guess even starting from there, and interesting to think about with language, I actually started out with German because I guess I identified with it more in my tiny Wisconsin community of all white people, and just my relatives still spoke German and people around me did, so I thought it was important to learn. And then I started thinking maybe Spanish would be more useful in my life, and it has been really useful, and I actually forgot all the German I ever learned, and I feel really bad about that. But another thing was, one thing I guess about growing up in small-town Wisconsin is that the knowledge about French or any other language and other languages that are offered at the university level aren't really expressed to you. Personally, I thought French was only for people who lived in France, and I didn't want to learn like some bougie language of just people who live in France. No offense to anyone who speaks French. But I was never taught, I love you, Lauren. I was never taught that there were like countries in Africa or in South America or anywhere else that used French and were very common. Like, you aren't taught about colonialism in high school exactly. So basically that's where I started off with perceptions of learning languages. But while I was in college, a huge thing that was so important was studying abroad. And I know that's a huge barrier to a lot of people to have that immersion aspect because it is really expensive. I'll tell you there are scholarships. Everyone always tells you there are scholarships. But that's really all there kind of is right now. But that was probably the most important part of studying a language. And it was in sort of a specific health program, which was really helpful for me because I could use sort of like public health type terms that have helped me in my job now and in things I do now. Yeah, and it's really important when, like, if anyone is planning on studying abroad of you students, it's really important when you are abroad to really speak your language like the whole time and try to only speak in that language. It's a huge difficulty and barrier, but force yourself to do it. All my friends, or the people I met, there were only 8 of us in our program. We made ourselves do that. We probably spoke in English maybe once or twice, or if it was something really serious like an illness or like a mental breakdown or something like that. Otherwise, we forced ourselves and pushed ourselves, and that's a really good way to do it. I guess a way that it's helping me now is also at the Global Health Institute. So I told you I started just translating Spanish emails. Well, now I've been there for 3.5 years, and I've gotten to sort of work my way up. And now I get to help with field courses because I've been doing all the background work for these field courses. Last year when I went to Ecuador, it was actually for work, and it was to help sort of explore sites for undergraduates to go to, and now that's going to be a field site in January for undergraduate students to go to. And I got to do that because I worked on like background things with Ecuador, and I got to do that because I knew Spanish. So it's all these little steps that kind of get you there. And now I get to co-lead a field course in Mexico this summer. So it's just grown into an amazing thing. And I know I'm not that experienced or anything like that, but I'm just saying you can get places with language. And I think it's another thing to say, I think it's amazing that Madison has academic languages, and it's a great thing that you have this opportunity to learn it. But also, like Claire said, to be very conscious of the fact that that is a huge privilege, and you are learning this language in a very academic setting. And like Claire was saying with when she actually got to the field, there are some things you might not know, because in the academic setting, things are very like by the textbook, and you don't learn the colloquial things or the slang or anything like that. So that's another thing to keep in mind, not to downplay academic programs. It's a great way to get started because it works at your pace and things like that. I guess it's another important thing to say that a few of us, I don't know, Lauren, you spoke English first, right? Yeah. All right, so we're all first English speakers. I think 2 of my coworkers are native speakers, Sweta and Roman. And I think it's really important to hear where they're from, but I think for this panel, they wanted to get sort of like a language learner aspect of it. But obviously, it's very important to know, or it's amazing to have that in your life to grow up in a language sort of thing. So if you have that in your life, you should definitely consider that a blessing, because it's so hard to get to that level of being able to just speak and have things come naturally like that. Yeah, and I wanted to touch on power dynamics too, of being an English speaker and expecting, like if you go abroad, someone might tell you like, oh, well, they speak English there, you'll be fine. Yeah, the people, like Claire said, who speak English are the people who are really educated. And do you only want to limit yourself to communicating with people who have that level of education and only have that perspective? So I guess those are just some things to think about. I don't know.
I'm asking you, even though I could have posed this question, how does one balance? But I think it's best if you tell us how do you balance.
I don't balance it very well. So in what? Let me think. So in 13 years of studying, of doing research about Malawi and about that area, I've only lived there for 2.5 years. And that's been about funding. And it's also been about life. You know, when is my partner willing to go? When are we willing to be apart for a long stretch? It's a long ways away. But a lot of it is about funding. It's expensive to go there. It's not expensive at all to live there if you're, that's easy. So if you don't feel like you need to live in a little expatriate community. But getting there is hard. So and getting time off from my work here is extremely hard. Right. I mean, I'm fortunate to be, I'm in a department of anthropology where we are expected to do field research. Now, we are not granted funds to do that field research, but if we are able to find funds, that's fine with the university, and they encourage us to take those funds and use them and take that time away from teaching. So that's really good. There are plenty of clinicians, nurses, and doctors who would like to do something like this on a more regular basis. One of the things that's worked out well for some people is to, band together with 4 or 5 other like-minded individuals. And so, say if there are 5 of you, you share 4 jobs. So one person can always be away. So that's a way that many people have made this work out. Each person is technically 80%. That usually covers your benefits and all those other important things. But I know that a lot of clinical people, doctors, nurses, pharmacists, dentists, have managed to make that work. Otherwise, it's a matter of sort of cobbling things together where you can, which is what I do.
In university, such appointments exist that you can have 80%?
I don't think those appointments exist. I think you have to make them. I think you have to approach, and not just within universities, but within places like Meriter Hospital, right? So you have to make a plan and convince your employer that it will work, and that's hard. But it has worked. There's actually a really useful book called, okay, it has some problems, but it also has a lot of practical pointers in it. It's called Awakening Hippocrates. And I'm forgetting the guy's name, Joseph O'Neill. It's published by the American Medical Association. And one of the things he does well is to lay out a lot of sort of practical suggestions for how to make this work in your life. So that may be a useful resource for her. Thoughts from?
And I think it is a challenge, particularly with I think the other members of one's family. My husband is a physician and is now currently in a rural medical practice here in Madison, which is wonderful for him after having worked for many years in public health. But now I was marooned personally I love rural Wisconsin for many things, but for global health work, it wasn't the. So I was there, and my work came to a screeching halt. So this, my connection with the university is a great way for me to continue my interest and work. And then I do a lot of independent consulting. So I kind of cobble together, as you say, work internationally, but it's for short stints. And if I didn't have my mother, who's sitting here also in the front row, I couldn't do most of what I do. She has stepped in for me on numerous occasions to help with my 3 sons. And I think you have to have a supportive family to do that kind of thing too. But it's true that I personally think in terms of public health folks and people who are in physicians, that we have to transform the medical education system so that we have a way that med students can pay off their debts in some other way, either nationally, domestic service, or through international service, instead of turning this young bright group into indentured servants so you know what I'm saying, for so many years you can't move, because you're just burdened by debt. And I think that both for responding to issues in the United States domestically, that we have such great need for medical and public health initiatives within the U.S. and internationally, if we could find some kind of core of service that people could sign on to and to give back without having to service debt. I think that would be a start to making more service-oriented jobs more accessible and easy for people to get into.
There are some small versions of that, but they're not very well publicized. So when I finished my training as an obstetrician, I went to work on the Navajo reservation in the southwest U.S., first in New Mexico and then in Arizona. And there's a program there that if you're willing to work in quite remote settings, the federal government will repay up to $30,000 of your loans per year for a total of 3 years. That's really good. I mean, that's a lot of loan money. This is not well advertised. It was slashed under the Reagan administration and has never really been built back up, but there is some. It's there. And there are some attempts to do this on the international scale now, too. I know there's some, like, 1-year loan repayment service things, but they're small.
I haven't seen it, but
yeah.
If that would work out, like, do you think I'm taking the right route as to my future with the military and my language skills in medical?
I think I would have to know you a lot better to answer that, is the truth. But I mean, I've had colleagues who have gone through the Army to medical school, and it's worked for them. I mean, including some that I worked with on the Navajo reservation afterwards. There's a version of uniformed service that can be done in poor communities in the U.S. and in the reservations, so that may be an option for you to look into afterwards.
Do you feel that your study of humanities brought sort of a particular advantage to looking at global health issues, or gave you a different perspective than, say, colleagues who didn't?
Well, I think political science, I studied political theory, which I think is the beginning of, I mean, for me it was the beginning of thinking about systems and
Human rights issues.
Human rights and equality and inequalities and equity issues from the very beginning. And I then became very interested in women's contribution to development within these different structures and how they were supported or not supported by the political systems that were. And that inevitably led really to the issue of health, because particularly women's health, maternal health, I came to see over the course of my studies and also early experiences that without some control over one's reproductive health situation, that women are barred from participating economically, politically. But it was a kind of development of ideas over time, but I think that the work on health with women is a foundation for a lot of other areas.
And then what is your graduate degree in?
I have a master's in international affairs and a master's in public health.
So I actually started out as pre-med and my major was biology. And eventually someone told me that you don't have to be a science major in order to go to med school. So I decided, oh, wow, I get to take all the classes that I'm really interested in, which is probably a bad sign for someone who's pre-med. So as I realized I could do something like LASIs, which is really flexible, it let me pick my own emphasis, which ended up being public health. And I still took all the pre-med classes. I actually took I took all of them, and then I took the MCAT, and then I decided, wait, I don't really want to go to medical school. So that worked out really well. I took physics and no-chem and hated it all those years. But I guess I think working with global health really made me realize how health isn't just being a doctor or being a nurse. It can be so many other things. It can be an engineer. It can be an agronomist. It's basically everything, because everything affects your health, like the environment, all those kind of things. So it really opened my eyes to that I could really study anything and still go into a health field or a global health field. And I guess language is just a good tack on for doing something global, even if you're just working in a local community, like if you're working with any of the immigrant populations, like one of the people in our office works with the Bhutanese refugee population and just different groups like that. So even if you don't have the funds to go abroad, here in Madison, even if you can't afford to go abroad and do a study abroad, there are still so many opportunities to work with people of different cultures and in healthcare within even Madison. And all you have to do is work to find those opportunities. So there are many ways to do it.
How do you find those opportunities? Like, how did you get advisors online?
Yeah, I guess both. The person I always fall back on is Lori Dupree-Brown, who's our education and engagement person, because she just has so many connections in the community. So I would just try to meet with her, and even if she doesn't have a connection, she can usually just tell you someone on campus who knows, because there are so many different people on campus who are working with different communities. And there are communities within the university of people from other countries doing different work that are also around you. Like, there are many resources on campus. All you have to do is find them and make an effort to find them.
But I also think there's an issue of volunteerism, which, I spent many years volunteering, and I continue to do so here today. My engagement with the university is on a completely volunteer basis. So I think that one has to, and that means that you need to have, a financial situation that would allow that, and that's not always the case for students coming out. But I think you also have to be willing to put in the time. And those opportunities become much more readily available if you're willing to work either at a very low cost or on a volunteer basis. And I think that's the way you start building up it's that catch-22 of they want people with experience, but how do you get experience? The way you do it, I think, is through volunteering to start with. If you can add that onto some income-generating activity to work on those issues that you're interested in and not be expected to get paid.
French is different from the European word, from the European about same, or you have spent time in Europe too, for sure.
No, I don't think it's the same. It's hard to. I think that there was a certain movement of people who came out of the 1960s movement in France, who, particularly for the area that I was involved with, who developed a global view that was very particular to that particular time and place, but it then was exported further to other parts of Europe, and then we have adopted some of those concepts here in the United States. But the idea of le droit de l'ingérence, which is a topic which is hotly debated, the right to intervene. Do we have a right? A lot of people feel, in the United States that we do not, that the international borders are, sacrosanct. We can't intervene into areas. Sovereignty is important. That's a big difference, and that concept, I think, that was developed by Bernard Kouchner, who then became a very vocal person within French politics, and I'd say the European community. He became this special envoy to Kosovo. He was involved in the Somalia crisis. He was a big voice in European humanitarian affairs. So that view kind of did take, I'd say, had a more European spread. And I think it's very different from the U.S. I mean, it's a big subject, but I think that we're very reluctant in the United States to step outside of our, to take a big a vocal stance, because when we've either gotten burned, and so as a result, now we've kind of retreated to ourselves, and that our policies, our leaders are afraid to step out and stand up for many reasons. But not that I'm saying that the Europeans are particularly interventionist at this point. I think they face a lot of the same problems that we do on the political front. But I think European students are much more active politically and kind of more world. They're trained better in history and politics, so I think they have a better worldview than American students do, which I think then builds a political worldview.
Being bilingual or speaking another language has helped with job opportunities or made them more employable than someone else who doesn't speak another language?
I can speak to that in terms of graduate admissions in anthropology. It's crucial. You have got to demonstrate some knowledge of another culture. You preferably should have spent a substantial period of time abroad to prove that you won't freak out and come home, because that's very disappointing to do when you're just about to write your dissertation, right? And you should have a good knowledge of another language to show that you're capable of the discipline of learning that language and also of stepping into somebody else's worldview. So for that narrow particular little field, it's really important. I hear from my colleagues that it's also very beneficial for graduate school applications in history, political science, some other fields. So I think it's beneficial. Students are often scared to take a year or two off in between undergrad and grad school, and that's a big mistake. Actually, for us, we look really positively on people who have spent some time figuring out who they are, being in the workforce, interacting with other people, rather than sort of the straight shot through. I think that is still a bit different in medical school, but I haven't been on a med school admissions committee in a long time, so I can't tell you that for sure.
Yeah. I guess what I'm doing right now is exactly that. I plan to go back to school, and language has helped me in the gap time I'm taking. I don't know about everyone else, but I went to school completely on loans, so now I'm just chipping away at that. So it's really, I don't know, it just feels nice to be able to be working on that even, and then prepare yourself to go back to school and make sure that's something you really want to do.
Those two really intense subject areas as grad students, and how maybe you've kind of married those two fields.
Well, my graduate studies were paid for through the FLAS, through the Foreign Language and Area Studies grant, which was very generous, and actually the requirements for that were relatively light. I mean, I still can't quite figure out why they did that. I mean, I think I had to study Urdu for, I had to sit in a, 3 times a week for an hour and study poetry, and then they paid for my graduate degree in international relations. So I don't know. I think that's still the case. I'm not really sure what the requirements for a FLAS is now, but I'm being a little funny about it. But I found it to be perfectly in tune. I mean, to do the study and to do the area study with it. Looking at it from different perspectives, I just think was an interesting way to put the two together and to do them side by side. And here in Madison, I mean, you have one of the great institutions for, the African studies, the South Asian studies. It's one of the top world-class institutions for that kind of. So I think they go together very well and complement each other, and I don't think they. In the sciences, I can't really speak to that because I'm not in the. Well, I think they go together well, and. Yeah.
I guess I didn't really study them together either at the same time, but I'm not sure that it would be all that different than studying, cultural anthropology and a language at the same time. Academia is itself a worldview, right? And science is a worldview. Scientific investigation is a language and a culture in some ways. I think we can say that without stretching it. So in some ways you're already bilingual, right? So you're learning a language at the same time I don't see it as a conflict. The timing of it, like making the time in your schedule, that could be a conflict. It's good you should know about the FLAS fellowships. I have sat on committees for those, and I can say they still exist, and we look really positively on people from engineering or biology or whatever who apply.
Now, and I think one of the
right.
issues is that we don't have a lot of science people in
right.
those programs.
Right. Right. So talk to your friends.
Yeah.
Right. Yeah. So I don't know. I mean, maybe you can answer your own question. Is it harder, do you think?
The timing balance is
You're studying Hindi?
Yeah.
And what's your science degree?
I'm in the PhD program.
Okay.
Yeah, so just in terms of convincing everybody that the other program is worthwhile and finding time in my day to do both things.
But Vijay just gave us a lecture in our class last night on environmental issues in India.
Right.
So
I mean, you're going to be able to communicate with your colleagues in a way that it's crucial to have people in the sciences who are really proficient in languages that are not English. It's crucial. So, I mean, there's a lot of great literature out there that's not translated into English that you'll be able to access. I know there's this sort of like, oh, well, among monolingual English speakers, like, wow, the world is all really coming around to English anyway, so why should we bother? I don't think that's true. Or if it is, it's going to take longer than our lifetimes, even yours. So.
I guess sort of like the different opportunities you'd be presented with after graduating and how those are manifest.
Well, they're different. I mean, Claire has had a OBGYN practice for many years, I mean, didn't she?
Yeah.
So that's, I mean, that to become proficient in that particular area, you really need to focus on that for a number of years, I would say, before you maybe necessarily start doing the global aspect, or did you start at the same time?
Probably true. I mean, I do have some colleagues who are physicians who have done global health all the way along. They tend to be, the ones I'm thinking of are all internists and pediatricians who also are involved in childhood malaria research, adult HIV research. So it's very closely entangled and has been all along with their clinical interests. If you want to go to med school, there's kind of really no way around the fact that got to slog through 4 years of med school, however long it takes you to get through the pre-med requirements, and then at least 3 years of residency training after that. That is a long haul. And the truth is that most people who go into that wind up pretty indebted and needing to repay those loans, and also at that point, like getting out of their training, and they're 30 years old and they want to start a family, and it's not great to be taking babies to Malawi or wherever. I mean, you are a brave example.
Well, my husband, I met him the first day of the first year of med school, and we were together through the 4 years, through internship, through residency, and the year he finished, he said, "I want to go into public health." I was like, "You're joking, right?" I mean, you want to go...
Right.
And so he left his clinical practice. He was supposed to go on to... He did 1 year, kind of couldn't stand it, and then went into international health, went to work for Save the Children, went to work for UNICEF, and actually never practiced clinical medicine until rural Wisconsin came along. Wow. a couple years ago. Wow. So... It's a huge commitment, and then to leave it. But now at 50, the two parts of his life have come together in a really nice way. Mm-hmm. But it's been a long period of having this, desire to do the clinical medicine side and to do the global health, and the twain haven't met for a long time, and so I think it's hard.
And it's also true, as Molly was saying, that there are a lot of ways to do global health. You can do great work through agronomy. The Engineers Without Borders program here on campus has done wonderful things with piping water, right? Clean water. There's public health efforts. You can be a translator, which is crucial to good health care and to good policy too. There's all sorts of ways. If you feel passionate about global health, there's all sorts of ways to make a real difference in health here too. I mean, because let's not forget we're part of the globe too. So, yeah.
Okay, so thank you.